Welcome to the Medical Device Made Easy podcast. Here is Munir Al-Azouzi from easymedicaldevice.com. And today I want to help you to place your class 1 device on the European Union market, and specifically with the new rules of the Medical Device Regulation. So for that, we will have a 2-part episode. So this week we'll talk specifically about the Corrigendum that was published and what are the consequences, how you should read that, and how now you should consider to place your class 1 devices that were under MDD on the market when there will be the MDR. And on the second part of the episode, so next week, we'll talk more about specifically class 1 devices that are pure class 1. So how you should do to place them on the European Union market. So for that, I have with me Erik Vollebregt. So I just interviewed him and it was really a great moment with him. So he really answered a lot of my questions. So don't forget also to subscribe to the podcast. Don't forget, please, to provide a review. I really like to read them and to also use them for improving the content of my podcast. So don't forget to do that. And also, if you have some colleagues that really want to get some answers related to the medical device regulation or medical device standards, don't hesitate to share the podcast with them. I'm sure this will really help them a lot. Okay, so let's now start the first part of the interview with Erik Vollebregt regarding class 1 devices. Welcome, Erik, to the Medical Device Made Easy podcast.
Thanks very much, Munir. Nice to be on the podcast again.
Great, thank you. So, Erik, for the people that don't know you, can you just make a small introduction and then we can really go to this topic of class 1 devices?
Yeah, sure. Yeah. I'm Erik Vollebregt. I'm a lawyer based in Amsterdam. I do a lot of work in European Medical Devices Regulation. I work for quite a lot of the medtech Europe members, so the bigger ones, but also for a lot of the smaller ones. And I have invented many wheels with regard to MDR, but also IVDR transition. And I've been looking at that since, before 2012 when the first proposals came out. I've been basically very busy with this. So I live and breathe medical devices law, you could say. I don't think that's exaggerated, actually.
No, it's great. And just a reminder for people, so I had Erik on many episodes of the podcast where we talked about MDR and IVDR. We talked also about PRRC. We talked about laying down notified bodies that are laying down service. So there is a lot of episodes where Erik was really helping us on that. So Erik, I think there is one topic that is really important for some people regarding the medical device regulation. This is some news that came from last week about a Corrigendum that was released about class 1 devices. So we have had also some news from this week about some votes that were happening. So there were also a lot of questions. Are all class 1 devices now extended until a certain date? So I think there is not a chaos, but I think a lot of people are now trying to find their way inside all these texts. Can you give more information about this Corrigendum and what is happening exactly?
Sure. Yeah. Let me break it down from the beginning, because this is actually it started quite some time ago. Because, you've got class 1 devices, but then there's also class 1 devices that need an additional another medical devices directive certificate, the measuring devices and the sterile devices. And then under the MDR, there is a new class of class 1 devices, the class 1 reusable surgical instrument devices that suddenly need an additional certificate under the MDR, which looks like the measuring and the sterile certificate. And then there are the group of class 1 devices that are going to end up in a higher classification under the MDR. So all of these groups, basically, they wanted to do something with. So then first Back in 2017, the CAMD released their first Q&A, in which they answered the question, how does it work with Article 123 for sterile certificates? Would those be covered by Article 123? And so Article 120, Section 3, so the soft transition. And they said, yes, these are covered. So we knew already then that there was a group of Class 1 devices that could use the Article 120 soft transition period. Then they discovered, oh, yeah, but this is still actually going to be a problem because there are a lot of devices that are going to be up-classified. So Class 1 devices that are currently Class 1 devices and that need a notified body CE certificate by the date of application of the MDR, so 26 May 2020. Those were, first of all, the new Class 1 reusable surgical instruments. That's one group. Very clearly delineated, although it's not always so very clear whether you are a reusable surgical instrument or not.
Yeah.
And as you probably know, and then there is the group of Class 1 devices that are currently just a plain Class 1, but which are classified because of the new classification rules in Annex 8. So you should think in terms of software is, of course, case in point, Rule 11. Substance-based devices, so anything that is absorbed, dispersed, whatever, for the mode of action, so Rule 21. Another tricky one is Class 1 devices that have nanoparticles in or on them, because those can also go up. And then, of course, you've got the situation of the devices that actually were the first ones to get a CE certificate, the inhalers that have a Rule 20 now, because the first CE certificate that was granted under the MDR was BSI UK certifying an inhaler that went from Class 1 to Class 2A. So you've got all these groups. Well, they realized at some point, this whole notified body thing with accreditation is maybe not the super fast train we hoped it to be, because, well, you remember the Commission said 20 notified bodies before the end of the year. It is now, it's 6 December.
Exactly.
And we have 9 notified bodies, of which 2 are counted double. Right. So in fact, we have 7 for the MDR now, and we have 2 for the IVDR. I'm pretty sure that when the Commission said 20 notified bodies, that they were double counting. So that means that we still need 11 notified bodies, even if you're double counting. And we have 25 days left in December. I'm not sure that we have 11 notified bodies in the Nando pipeline by now.
It's maybe a Christmas gift. They are maybe waiting for 25th of December to give that as a Christmas
no idea.
gift.
I mean, the only notified body that I know is in the Nando pipeline right now is it's actually DECRA Netherlands.
Okay.
Because it was so funny. There was this event where people from the Dutch Ministry of Health completely misspoke, and they talked about a third Dutch notified body having been accredited. Everybody was like, "Oh, who would they be?" And then, of course, they couldn't back out of it anymore, and they had to correct it. But so we know that DECRA Netherlands is in the pipeline, which makes the Netherlands the member state with the highest number of notified bodies per capita, which we will probably lose if Liechtenstein gets their own notified body, but I'm sure I'm not sure they will. But anyway, so these notified bodies were not going as fast as expected. So they were thinking like, oh shit, this is going to be chaos, because and that's especially a problem with the class 1 devices. These companies usually have zero experience with the notified body. They have no relationship with the notified body, and still they need to go through a complete certification for CE certification for an MDR device. Well, if you look at the second CE certificate that was granted after BSI did with theirs, I think too soon, I think with a much more impressive thing, class 3 software.
Oh, which was a class 1 before, I suppose.
Which was a class 1. So that just shows what kind of situation those class 1 devices are in. If you look at a normal certification period for a class 3 device under the MDR, you would be looking at 8-9 months maybe to a year. Well, if we count back from May 26, that's 5 months. So then we would need to subtract another 7 months into 2019, which would put us, basically back at May. So we would have needed notified bodies able to certify class 1 software devices that become class 3 under the MDR by May 2019 in order to be in time, which we didn't have. So then they realized, okay, we need to do something for these devices as well. And then the question was, how? Because we cannot change the MDR anymore, because that will also take too long. Oh yeah, remember April 2018, we did this nice Corrigendum. Let's do one again. So then they came up with the Corrigendum.
Yeah, which was released. As soon as it was released, a lot of people read it. There was some misinterpretation also by reading it, because it was written in a way to say that it's for class 1 that need a notified body, etc. But at the end, the people had to guess which product are we talking about. There was, as I've said, a lot of question, and there was this vote that happened the December 3rd. I saw a streaming of the vote, and there was this, can't remember the name of the person. It was a woman that was speaking, and she was saying that, we agree to vote for it, but we are not happy on the way it was done, and we are not happy that it was coming on a Corrigendum. So is a Corrigendum the place to put those kind of changes?
Well, yes and no, depending on who you ask, I guess, because a Corrigendum, it's quite funny, because if you look at, of course, I'm a curious person, so I looked at other Corrigenda for other regulations. And so there are several procedures. You can either do a Corrigendum for one language version only, because there was an obvious mistake in one of the language versions. Like, for example, you say dog in 23 languages, and then you say cat in one other. Okay. Well, then, of course, that's an obvious mistake, and there's a procedure for that. There is also a procedure for a mistake in all languages, and that is what they've been using here. Now, the problem is, of course, that as soon as you start changing legal texts, then you start balancing on the basically on the razor's edge of, am I correcting a mistake or am I changing the law? Now, a Corrigendum is not allowed to change the law. It's only allowed to change obvious mistakes. And if you look in the Corrigendum, the parts that are not about Article 120 Section 3 and Article 120 Section 4, I see some corrections in there that are really obvious mistakes. But if you are going to give a whole, several classes of products an additional transitional period that was not originally foreseen in the law, then it becomes quite interesting whether you are actually changing the law or not. And this is what this parliamentarian was referring to. And this is also why the European Parliament's plenary still wants to say something about this amendment. So that means that the vote we had on 3 December is not the final word on this.
So it means that it can change and we can still remain on the previous situation. Still, class 1 products are not extended. I mean, class 1 that are classified are not extended. And then you need still to look for a notified body.
As I understand the procedure, that is still possible. Yeah. And of course, that would be a disaster because, well, we've been counting on our fingers. Remember, if you count this many months back, you are too late. So it would be those products. So so it really depends on whether the European Parliament wants to create a lot of chaos or whether they are really dogmatic in saying no, this is not supposed to happen by Corrigendum, but we need a change in the law. So
when is the Parliament will vote on that again? When is there a date already, or?
I think it was 16 December or something.
Okay,
but I've seen people on LinkedIn say that they can't find it anywhere on the agenda yet.
Okay.
It would be funny if it were on 16 December because it would be on my birthday.
Okay.
It would be a nice birthday present.
So I hope it's a good sign also.
I haven't had time yet to see exactly on what time and date it was, but it should appear on the plenary's agenda before Christmas.
Good. So we'll see if it's working and if it's good. One thing. So as we said, so now for those products that maybe will be transitioned until 2024, just to remember to people, the product should already be on the market before May 26, 2020. So having a declaration of conformity available before that date. Yep. But there is a but. There is a but because if some manufacturers think that they will be fine until 2024, they can be mistaken. Only in case they are making a major change of their product. If they are doing a major change of their products, what is written is mainly that they have to comply to MDR. Is it correct?
Yeah, that's correct, because they are included in the Article 120, Section 3 regime, which means that you get more time, but you don't get to make any significant changes to your product. So if I were a software manufacturer at the moment, then and I would think, woo, I've got more time until 2024. Yeah, that would only be true if I'm not planning any significant changes to software until 2024. Is that realistic for software? I do not know the software that does not make any significant changes or need any significant changes in a few years. So that means that if you are planning any kind of innovation to your product or any upgrade to your product or any line extension to your product, that is likely going to be a significant change, and that would cost you your soft transition status. So that means that's one of the problems, that the concept is still pretty unclear. Because I've been tracking for other MDD and AI MDD products that are also under 123. So what is a significant change? And what you see so far is that notified bodies, that are mainly the ones interpreting this now, they will only tell you what is not a significant change, okay. Right? So there's lots of things that are not a significant change, but there's no absolutely sure positive description of what is a significant change. But it means that even as a class 1 manufacturer in that case, you have to have a super solid quality system procedure that is extremely sensitive to any product changes.
One thing that is also unclear for me is the fact that when we are class 2A or class 2B or class 3 or class 1 SM, etc. devices, we have a notified body that we should inform when we are making those changes. And the notified body has to review that or accept that, or he has to process all this. On the case of class 1 devices, if tomorrow I'm making a change, should I inform anybody? I'm not sure. Or is it the competent authority? Or what is the process for me?
Well, that's a good question, because it's because that's one of the big problems here. For class 1 products under the MDD, there was always ex-post market surveillance by the competent authority, with companies not having a positive obligation to tell the competent authorities about any significant changes that they would do to their products. So that doesn't change. But now we're in the situation, because with a notified body, you always needed to check with the notified body, is what I'm doing a substantial change? Because that's what we needed to do at the moment. Because mind you, a substantial change in the meaning of the NBOC guidance is not the same as a significant change in the meaning of Article 123. A lot of people mix that up, but that's not a class 1 problem, fortunately. But let's go to the class 1 problem. So then the class 1 problem is, what is a significant change? Because, as you say, the competent authority is responsible for overseeing this, but there is no mechanism for manufacturers of class 1 products to check this with the competent authorities. Yes, they can send an email to the competent authorities saying, hey, I'm going to do a software update. Is this a significant change? Probably you are not going to be the only company sending in this question. So what we are going to see is that the manufacturers will look for certainty. But these competent authorities, they will need to develop a policy to deal with the situation of a lot of people asking a lot of different questions about what is a significant change. Now, you may know that back in the days, in December 2017, when the CEMD roadmap came out, there was a commitment of the competent authorities, because they work together in the CEMD, to issue guidance on what is a significant change.
Okay.
Have we seen it? No, we haven't seen it. Never, ever. But they've also never amended the roadmap, right? Because it would still be coming.
Okay.
And if you look in, if you look in the MDCG rolling guidance forecast document, I'm not entirely sure if there is anything in there on significant changes, but that's the MDCG and not the CAMD.
So it's maybe one of the guidance that will be released. I think there was still around 60, a bit less than 60 now, maybe guidance that should be released. I suppose it will be one of them then.
Somewhere in the pile, yeah.
Okay.
But they would be doing the whole market, of course, an immense solid favor if they would release guidance on this point, because, at least the class 2A and higher manufacturers in soft transition can go to a notified body and ask, because that's what they're paying for in the end. But I'm pretty sure that the class 1 manufacturers that have less experience with this kind of stuff will not be treated as customer-friendly as notified bodies would by their competent authority. And even notified bodies are not the most customer-friendly organizations at the moment, because they're also totally overworked. So I really see some issues coming. So either we need guidance on this subject on a European level, or the competent authorities need to start working on this on a national level. And then you'll be in one of these confusion everywhere situations, because then there might be differences between interpretation of what is a significant change. And of course, that's not what you want, because it's a European concept. So the only relevant way out is that the Commission or the MDCG, I should rather say, ponies up a notice on a significant change because it was on the roster anyway.
Okay, so I think it will be a point that people have to really understand how they should work on. I can imagine also that there will be some manufacturers that will not consider their changes as significant change, and they will continue to release the product as is with their version. But if they do that, is there a risk for them or?
Definitely, yeah. You could see I was getting all enthusiastic about it because this is actually one of the problematic consequences. Because again, for people that are being threatened by a significant change, at least you can have a discussion with the notified body, like, are you sure? Yes, no, I don't believe you, I hate you, I love you, and so on. But with class ones, you have the problem that as soon as you, you may ask the competent authority and they may never answer because they're not under an obligation to answer.
Yeah.
Then there are the companies that take their own view and they will do it anyway. But then when the problem is that as soon as retrospectively it turns out that something was a significant change, you lose the protection from Article 123, Section 3, retrospectively as well.
Okay.
And that means that all that time you have been placing a product on the market that was not CE marked. This is a mortal sin under national medical devices law, and you can get fines, you can go to prison, all that shit. Sorry. all that stuff that can happen. So I mean, it's bad situation for companies because they can be really unhappily surprised. And if you have a competent authority that is, let's say, not in the business of warning people, but rather will enforce immediately, then inadvertently you can create a very illegal situation for yourself with quite big consequences.
So please consider to really respect the law, even if you think that nobody is watching, because retrospectively you are still liable. So products can be still maybe removed from the market. You can still have a fine. There is more consequences that can happen. So please remain liable, as Erik said. Erik?
Yeah, and also I would say please resource competent authorities appropriately so they can quickly respond to these kinds of questions.
Yeah, exactly. I think, I think it's each competent authority has to do that. What I see also as a problem is the fact that one competent authority can say this one is not a major change, but another can say yes, it is, etc. So it's also the chaos that can happen. So maybe some collaboration should be really created here. But I hope the MDCG is really creating this document with what is really a significant change, so that we are maybe released from this. Competent authority will be released from taking decisions on that. So I hope it clarifies a lot of your questions. So Erik was really kind to provide a lot of details related to this extension of Class 1 devices until 2024. We still have things to come next week. Don't forget to also come next week to get the second part of the episode related also to pure Class 1 devices. Okay, so it was really a pleasure to have you, and I wish you a nice day.